Welcome back to Live from the Clinic Behind the Barn Door. I'm Dr. Dawn Harper, and this week I'm joined by my good friend Joanna Nicolas. Joanna has over 25 years of experience supporting families who are struggling to cope. So if you're finding things tough during the lockdown, she's the lady, she's here to help. We'll be taking your questions on coronavirus or any other health concern you have, and you can email me directly now, drdawn@barntheatre.org.uk, or comment with your question on the live stream video. So before we start, I thought it might be useful to explain why the government in the UK is not recommending we all wear masks. We've heard a lot about this in the press this week, and we do seem to be at odds with a lot of other countries. The thinking behind this is that the mask really is there to protect other people from you if you are shedding virus, rather than to protect yourself. And one of the concerns that has been raised in British government is that actually wearing a mask might make you feel a little complacent maybe, and a little less strictly adhering to things like social distancing and respiratory hygiene. So we're not recommending at the moment. There is a very small amount of evidence that masks might be useful, but it is very limited evidence. And so the general feeling at the moment is that we don't have enough supplies of everything that we need as it is, and it's important that we make sure we've got masks for those on the front line. But I will be revisiting that, I'm quite sure, because we are constantly looking at the evidence, and guidance may or may not change in the future, so I will keep you posted. So I think really let's just get started with some of your questions. The first question is from Jackie, and Jackie says she's got a blocked nose and sore throat. No fever or cough. Her symptoms have been going on for a couple of weeks. Could this be COVID-19, and should she be self-isolating? Jackie, it could be. Increasingly, we are learning about coronavirus that some people have the virus with no symptoms whatsoever. And in fact, when we saw all those images of people locked in big cruise ships for a very long period of time, when they were finally testing everyone, there were a significant number of people who tested positive, having had no symptoms at all. So I think, given that the most common symptoms still are a fever of 37.8 or more, and or a new and persistent dry cough, we are recognising other symptoms. So we know that several people are reporting a loss of sense of taste or smell. A lot of people are having a sore throat, some muscle aches and pains, and some people actually some gut symptoms as well. So I think, Jackie, to be safe, we have to say to you, yes, treat this as though it is coronavirus, and please stay indoors for the next 7 days. Before I go to the next question, Joanna, you know, we've got you here and your expertise on challenging times for some families, and one of the things that struck me recently is that we're hearing, you know, a 25% increase in the domestic abuse helpline calls, and of course that's just the people that are physically able to make that call. Yes. What are your thoughts?
Thank you, Dawn. It's such a pleasure to be here. I think it's so important for people to understand how vulnerable some individuals are at the moment. And if you are a victim of domestic abuse, and domestic abuse takes many forms as well, it's not just about the fist. A lot of people think it's just physical. It's not. It's control in many, many different ways. It's so important for anyone who feels unsafe in their own home to know that the police are absolutely there for you, the charities are there for you, all the services are there for you. And a key thing to bear in mind is that if you are in fear of your life and you ring 999 but you aren't able to say anything because you're so frightened, what you do is, once the call connects, you press 5 and then 5 again, and the police will then know that you are saying, I'm in fear of my life, and they can trace where you are.
And they'll come to you.
And they will come to you. So really important that people don't suffer in silence and think, well, everyone's just thinking about coronavirus. That is not the case.
Yeah. Thank you. Joanna's going to be with me until the end of the show, so you know, if you've got questions for her, please do message them in. You don't need to use your real name. You know, she's here to help, because I think this is probably, you know, we're in week 4 of lockdown now. The novelty, if there was one, I'm sure is wearing off, and a lot of people are going to be really struggling, so we are here to answer your questions. I'm going to go to a slightly more light-hearted one, and that's from Kirsty. I'm hearing mixed messages about whether or not it's safe to use ibuprofen for symptoms of COVID-19. I'm self-isolating and have run out of paracetamol. Please, can you clarify? Yes, Kirsty. That's a little bit like I talked earlier about the face mask messaging might change. Ibuprofen messaging has changed, and that's why you're getting the mixed messages. So initially, we noticed that some young people seemed to become unexpectedly and disproportionately very unwell. And there was a thought at one point that it might have been that using ibuprofen in the early stages of the illness had actually paradoxically caused a worse inflammation in the lungs. More research has been done on that, and I think it was just this week that the government came out with the findings of that to say that actually it's completely safe to take ibuprofen. So that's just where the messaging has changed as we are continuing to learn more and more about this virus. So we've got a hello from sunny Scarborough. Alan, good to see you. An anonymous question. Okay, I'm a single mum with a 12-week-old baby who I've been told has colic, but I'm really struggling as he cries all day and all night and I can't seem to settle him. Oh goodness, I'm frightened if I tell anyone they'll take my baby away. Joanna, that's one for you, I think.
Yes, and Dawn, it's something that we hear all the time in normal times as well. Anybody who has had a baby knows what that feeling is, where you reach the end of your tether. And nobody wants to say, I'm struggling and I'm finding it really hard. And that's in normal times. We know that a horrible thing that we have to be clear about is that it's very easy to kill a baby by shaking them very little. So they are incredibly fragile. People always say, oh, babies are so strong. They're not. Their brains particularly are very, very fragile. It is absolutely a strength to say, I'm struggling, to ring up your health visitor, ring up your doctor, ring up any source of support you've got and say, I'm struggling. And people are so frightened about having their babies taken away from them. Actually, the number of children that are taken away from their parents is so tiny, so tiny. And it's only in the most extreme cases that it happens. And most of what social services does is about supporting families. Nobody wants to take a baby away from their mummy, from their daddy, and it will only happen in the most extreme cases. Most of what social services does is about supporting families. So be brave enough to say, I'm struggling. It's unimaginable. I haven't got a tiny baby at the moment. It's unimaginably how hard it is for families at the moment.
I'm sure, and you presumably haven't got those normal networks, maybe mum who could come and give you a bit of relief. And I think I can only echo what Joanna says. As a GP, actually, it's not the mums who come and tell me they're struggling that I worry about. It's the ones that we don't hear about. As Joanna says, it's not a weakness, it's a strength, and there is help out there. So please, I hope that's given you the confidence to reach out to whoever you feel you can. As Joanna says, GP, health visitor, social services, honestly, make that call. So Claire, I've seen a lot on social media that you can have no symptoms of COVID-19 and then die suddenly. Is this true? It's very scary if it is. Okay, so we do know that some people will have coronavirus and have no symptoms. One of the reasons why we are in week 4 of lockdown and we're only beginning to see the slowing down of the increase in deaths is because the natural progression of the disease is it takes sort of 5 to 7 days to incubate, and then most people have symptoms for 7 days and then get better. Those that don't tend to get worse over the next week or two, and sadly those that lose their lives do so in that 4th week. So that's that's the way this happens. You don't go from fighting fit to dead. Social media has done a lot of good. It's been really good for allowing people to stay in touch, but as always there are problems sometimes with social media, and I think we've got enough scary headlines without adding that. Joanna, another one for you, I think. I keep hearing a lot of shouting and banging next door. This is another anonymous question. I'm worried if this could be domestic violence. What should he or she do?
Same message really, Dawn. If you're worried about anybody at all, do something about it. And again, ring the police, say to them, that might not be a 999, that might be a 101, the normal police number, but say, I'm not sure, and you can do it anonymously, because people are often worried about the repercussions on them. Do it anonymously and say, I think they might have just had a baby, or there are small children, or whatever you think tell the police that, and then let the services deal with it. But I would say always do something, because people often say to me, but what if I've got it wrong? It would be so awful if I've got it wrong. But the question to ask yourself is, what if you're right and you don't do something, and then something terrible happens? So again, we want people to be sort of calm and measured about things, but if you're worried about anybody, do something about it always.
We do hear about it, don't we? We hear when, sadly, things have escalated and something dreadful's happened.
Yeah.
You often hear people saying, well, I did wonder, or I had thought about.
Yeah.
And I guess nobody wants to be in that position.
And I meet lots of those people, unfortunately, doing the job that I do. I meet lots of people who, when I'm doing reviews when children have died in terrible circumstances, and they say, well, I saw this or I heard that, and they come out of the woodwork afterwards. And I say to them, did you think to tell anybody? And they say, well, no, because I'm only a da-da-da, or I'm only the neighbour, I'm only the this or that. If you're worried, do something about it.
So there you go. So please do pick up that telephone and make that call. I'm just having a few comments here about don't forget mental health problems. Do you know, absolutely, there's one from here from somebody called Laura. One of the things that we're very conscious of in general practice is that isolation and loneliness are a huge problem at the moment. But we do know that we are seeing increasing amounts of people, or speaking to increasing numbers of people who are very anxious, and understandably. People are becoming quite depressed. I mean, I think one of the things that we were chatting about before we came on air was financial strain. A lot of people really struggling financially, and the effect that has on mental health. So, please do, if you've got questions that you want to put to us, please do. We've got another anonymous question here. I'm worried about what my 12-year-old is doing on the internet. Since lockdown, he's spent all his time literally locked in his room. Yeah, what do you do?
This is a real worry at the moment. We know that there has been a massive increase in paedophiles using the internet to groom and to get at children. They are very clever. They know what they're doing. They know that our teenagers are going to be spending even more time on their devices. I would say ask the experts. Go and look online. There's so much brilliant information out there. Go on the NSPCC website. Go on the Met website, which is the Child Exploitation Online Protection Service. There's a lot of really good advice about how to keep your children safe online. And again, this idea that they're okay, they're fine, they're safe because they're in their room, they're not out in the park at 2 o'clock in the morning. Actually, it's a more dangerous place.
Absolutely. Right. I've been housebound from last June. This is from Kando. I've been housebound from last June, but appointments are mostly cancelled. Any suggestions? I'm not sure, Kando, whether you mean that whether that's appointments with GP or appointments with the hospital. One thing that I would like to make really clear, actually, is that I think we got the message of please don't come into the surgery if you've got coronavirus symptoms out there very clearly, and the public have been amazing. Your surgery door will be shut. My surgery door is locked, but that doesn't mean to say that the surgery is shut, in that we are still very much talking to patients. And so although most surgeries now you won't be able to book online anymore, and you will have to speak to a doctor or a nurse before you can actually get an appointment. And the thinking behind that is we just don't want that huge footfall coming through the surgery, meaning that we could be transporting the virus between lots of different people. So we are very much adhering to social distancing. In my surgery, we've got one room which is allocated for examining people, and the appointments have to be separated by enough time so that we can disinfect the whole room. We've removed everything but the barest minimum of furniture, so it's pretty Spartan. But Kando, your surgery is open, so if you need to speak to somebody, please do. If it's a A hospital appointment, that is slightly different, and a lot of routine appointments in hospitals are being temporarily cancelled. You will be offered an appointment again. There are some appointments that are still being offered, but it may well be, depending on the specialty, we do know that a lot of the staff are being relocated to work in different parts of the hospital. So some routine appointments, I'm afraid, have been cancelled. Question from John. I'm getting a lot more deliveries now, aren't we all? And I'm reading that you can catch coronavirus from cardboard. What should I do? Okay. So the virus can live outside of the human body. It seems to like hard surfaces better than soft, so we think it can last for about 3 days on metal, for example. It's probably nearer 24 hours on cardboard, but it certainly is possible to contract the virus from contaminated cardboard. Now, what you'll probably find, most delivery drivers they're wearing gloves. They will usually just leave the parcel on the floor and take a photograph of it by your door rather than you having to sign for it, so that we're reducing any contact. What we do, and what I get my mum and dad to do, particularly because they're 82, so I've got them completely locked down, is I say bring all your post and packaging in, either undo it on newspaper on the surface and then discard all of the wrapping and the newspaper and wash your hands. Or if you are opening it directly onto a work surface, again, open it all, discard the packaging, wipe down the surface and wash your hands, and then look at the contents. And I think that way you should be quite safe. Another one for you, Joanna. We touched on this a little bit earlier about finance. I haven't got the money to buy toys during lockdown. What do I do to keep the children entertained?
And that's such a good question, Dawn, because there are so many people who are in unimaginably difficult circumstances at the moment and have literally no money at all. And everyone, we're hearing about people doing puzzles and doing all these things. They all cost money. But there is a lot that you can do in your home, whatever you've got, to entertain children, and it doesn't have to cost money. I remember when my children were little, they used to play with the calendars, and they were spacemen. And my friends used to say to me, can't you buy them space hats? No, because it's a calendar, it's just as good. So play with anything. Pasta, necklaces, brilliant. Making jewellery out of pasta, making Play-Doh out of flour, a packet of flour will cost you 50p. Just doing, things, all the old-fashioned things like hide and seek, get things on a tray and they have to guess what's on the tray, and you cover it up and you add more and you take more away. It all puts pressure on parents because we have to be more creative about it. Yes. But thinking beyond gadgets and toys and things that cost money. You look around your house, there will be so much that you can turn into a game. And again, there's so many brilliant things now on the internet about how you can play with your children, what you can do with your children that cost no money at all.
Yeah. Yes, goodness me. So, I've just got a reply back from Cando. It's a neurologist appointment, I understand. It is worth just contacting the department directly, Cando. So on your letter, there will probably be a direct telephone number through to the secretary, usually in the top right-hand corner of the letter. And if you give them a call, they may be able to tell you when. Sometimes what we're finding is that actually they're cancelling everything immediately, but then they're just starting to release a few appointments. And again, it may be appropriate to have a telephone consultation with your specialist, if they can't physically get you into the hospital. And also, I do understand that a lot of people are not really wanting to go to hospital at the moment. So... Okay, an interesting one here. What are our thoughts, I guess, on the differing public health strategies taken by different countries like Sweden or Iceland? I think Sweden is the country that's still allowing bars and so on to stay open. Although I'm told, interestingly, that Sweden has the highest number of single ownership properties. So more people living on their own, and therefore, because we know that most actually of the transmission of coronavirus is within households. So that's the greatest transmission. But the question goes on to say, or is it too early to tell? I think it is too early to tell. We are on a steep learning curve with this virus, and I think we will be learning for months, probably years to come. One of the things that I'm asked a lot is when I think the lockdown might be lifted, or how I think that will look. And I think the honest answer is I actually don't think that the government are being secretive about this. I think we don't yet really know. There are, and I'm sure it's something close to your heart, Joanna, one of the things that I know I've been told is there are genuine concerns about how long we keep schools closed for, because the gap between the haves and the have-nots could become irreparable, So if you've got two parents who are well educated themselves, and you've got space and you've got facilities and you've got the internet and all this sort of thing, then your child is likely to have more home educating than somebody who's living in very cramped conditions, maybe without the internet, maybe a single parent. And so I do think that the combination of the concern over that big gap in potential education, the combination of that and the fact that most young people, and of course we've heard some horrible headlines of young people losing their lives, but thankfully most young people who contract coronavirus tend to have a milder disease. So I think we may find that when restrictions are lifted, and we don't know when that will be yet, the figures are starting to look more encouraging. I think it may well be that schools will go back first. I'm afraid I think pubs and bars and restaurants will probably be the last to open. And I think we do have to be prepared for perhaps a little bit of oscillation. It may be that some restrictions are relaxed a little, and inevitably we will see then that the cases go up, and sadly deaths may go up again as well. And then it may be that we need to restrict things back down again. So I think it's a real movable feast, but it certainly isn't going to be a case of 3 weeks today we're all back to normal, I'm afraid.
Can I just add to that, Dawn? I think too about schools, that there are school places all the way through this for our most vulnerable children, as well as for children of key workers. And I know that there was a bit of a worry at the beginning that there was going to be a stigma as you see the children going down the street. Oh, well, why are they going to school?
Right.
But actually, because there are so many phenomenal key workers and their children are going to school, there isn't that. We don't want there to be that stigma, and for people to make assumptions about your children going to school. And it's there for children of key workers, but also to protect the most vulnerable children.
And in practical terms then, I guess it may vary from school to school, but if a child is registered as being a vulnerable child, then obviously that would be known and that child would be invited into school. The lady who spoke earlier, her baby was only 12 weeks old, but say, if a mum or a couple are at home with a child and they are, losing their temper, they're just so frustrated, are they able to just ask for some schooling directly, or how would they go about that? Is that through the GP?
There should be support through other ways as well. So if you've got a child under 4, you would start with your health visitor, and you would talk to your health visitor. If you don't have a child under 4, then it might be best to go to the school in the first instance. But there's lots of, it's called family support work that happens. Right. And it's happening a bit differently at the moment, of course. But there are still visits going on in homes. And there are family and children's centres all over the country as well. And they offer lots of support. They're doing lots of work. So I would say child under 4, start with your health visitor. Yep. And over 4, either talk to the school about it, or to your local, they're called some areas, they're children's centres, some areas they're children and family centres, and talk to them about it. And then that can start the wheels in motion.
Great. Thank you. Thank you. Oops. Do you think hospitals have cancelled surgery to deal with virus patients, are hoping people who've had surgery cancelled, oh my word, will die of the virus or die from their condition, so they've not ever got to do it. So I think this is somebody who's wondering whether actually we're using this as an excuse to not treat people, and I absolutely couldn't disagree with that more strongly. The whole point of trying to manage this virus and trying to expand, any of you who were listening last week will know that I spoke to Dr. Dave Windsor, who's the clinical lead for intensive care in the county here in Gloucestershire, and he made no bones about it. We are expanding our ventilating facility sort of 5 to 10-fold in order to make sure that we are as prepared as we can be, and we have greater capacity. That's the whole point of these Nightingale hospitals, that they are huge hospitals with a massive capacity that we hope won't be filled. It's that we want to try and make sure that we can. There is huge frustration, I understand, if you've been on a waiting list for a while for an operation, and then that's now been cancelled. But the rationale is not about not caring about whatever your operation may be. It's simply that the theatre space, so in Gloucester and in Cheltenham, the normal theatre space is being converted into expanded intensive care space, and so that's why we're having to cancel operations. Another thing that you and I were chatting about earlier, and I've had a few questions about it, was chemotherapy, and patients very anxious if they've had their chemotherapy delayed. The thinking behind that is, and it's very much, those decisions are made on an individual basis and should be made between the patient and their medical team. But the worry about chemotherapy, of course, is it absolutely knocks your immune system for six. And so the concern is that if you start somebody on chemotherapy, you could render them, very vulnerable to coronavirus and to not being able to fight it off. So that's the thinking behind that one. Okay. Question about herd immunity. What do we think about herd immunity? So herd immunity is basically where the population, a lot of people have had a particular infection and they are therefore naturally immune, and that means that it's less easy for the virus to spread around the place. One of the reasons why we are in a global pandemic is that coronavirus came along, and this particular strain basically had an entire globe of humans that it could infect, because none of us were immune to it, and that meant that it could absolutely run amok and travel and spread between people very quickly. You can't turn the television on today without hearing about work being done on trying to develop a vaccine, and that, we hope, will be a real game changer. But, these things take time, and we need to know that they are, A, effective, but B, safe. So, I really don't think that we are likely to see a vaccine in under a year. But of course, if we can then vaccinate the population, we go back to having this, rather than having a whole globe of people who are vulnerable and can be infected, we would have a whole host of people who are protected. But, we still don't really know how long we might have immunity post-infection at the moment, and we spoke last week, if any of you were with me last week, we spoke a little bit about antibody testing. Now, I do know that some private clinics are offering antibody tests, and you might think, well, that's great, okay, if I have an antibody test and it shows me that I'm immune, that I've had this infection, then I can actually volunteer to work, I can go, I'm not a risk to anyone, and I'm not a risk to myself. That's all well and good as long as that antibody test is absolutely reliable. And at the moment, I had a conversation with the Department of Health last week. At the moment, whatever the claims, there are no CE-approved antibody testing kits. The government, you may have heard, bought 3.5 million testing kits, and they had them analysed and assessed through a laboratory in Oxford, and unfortunately they were neither sensitive nor specific enough. So they threw up too many false positives and false negatives. And really, that is incredibly dangerous, because the exact opposite then happens. You have your antibody test, it says you're immune, but you're not. And you go out and about putting yourself at risk, but also putting everybody else at risk. I think that's that from in there. Anything you wanted to ask me, Joanna?
Yes, there's so many things, Dawn. I could just ask you questions today. But one of the things that I've read a few times is about if you've had a BCG vaccination, that's going to protect you.
Well, that's being worked on. I don't think we've proven it's an association, I think, and that's where you start with these things. Is you look for associations, and then you go, right, is there something in this, and is there something in the vaccination specifically for TB? I don't think it's been proven. I don't think it's been proven. No. I've just got another one here as well. A couple of weeks ago, I had the most horrendous headache. It lasted 7 days solid, and I never get them. This person isn't saying, is that COVID? But it sounds to me like you had a headache for a week. You've now been headache-free for a week. And I think we have to say it may well be. It may well have been COVID. We are seeing people with headaches. A week is around about the time frame that most people seem to get symptoms and then get better. So we've got no guarantee. And until we get these antibody tests, we've got no guarantee. But I think it would be reasonable to assume that might well have been coronavirus. Yeah. Yeah.
And Dawn, you touched on this earlier, but and again, I'm not a medic, but what I read is that the fact that you're not protected if you've had it, and that people, I don't know if what I'm reading is right, but there are people who are getting it again quite quickly.
So one of the things we have started to recognise is that when we so the two sorts of tests that we're doing, one is the swab test, that's the have I got it now test, and then the other one, which I just referred to, is the antibody test, which is the have I ever had it. What we're learning is that in the very early stages, perhaps before you get symptoms, you may not test positive, so you might have a negative test very early on. But interestingly, it then goes positive when you do the throat and nose swabs. But then, if the virus then goes down deeper into the lungs, it's perfectly possible to then test negatively again, even though clinically, you've tested positive previously, and clinically you absolutely still have symptoms. It's actually possible to go on to have a negative test. We are still learning about how long any immunity might last for. It had been hoped that it would be sort of 6 to 12 months, but you're right, we are seeing people who seem to have got recurrent illness quite quickly. And I think we're back then in the realms of, needing this vaccine. And there's a huge amount of work being done by a lot of different companies. There's a real race on. Yeah.
And is there any understanding about why it seems to affect people in different ways? And again, I read of people, I don't know this factually, but I read of people who were fit and healthy and young, and they have died tragically, and yet I know 2 individuals personally who were in the middle of chemotherapy, who got the virus, who have both been in intensive care, both survived back home doing
it's amazing. Yeah, it is amazing. So we are just learning all the time, and it's not clear why. So we talked right at the top of the show about ibuprofen, for example, and there was a theory for a while, could that have been an implicator in why some people were so much more sick than we'd have expected them to be, and we've now decided it's not. We don't know why, but of the people who are in intensive care, it's sort of 3/4 men to 1/4 women, and we don't fully understand why that is. It may be, one theory has been, could there be some kind of protective effect from estrogen? But actually, if you then look at the average age of those people who've lost their battle with the virus, they would be postmenopausal women, so unless they were taking HRT, they would have presumably lost that protective effect. There's also been some theories a whole host of diseases called autoimmune diseases, where your body fights against itself, are more common in women generally. And so could there be some kind of link there? And we're still working on that. The other thing that I think is quite striking when you look at some of the younger people that have died, it does seem to disproportionately affect Black, Asian and
I was going to ask you about that.
ethnic minorities. Yes. So and again, we don't really understand why. One theory for that was that we know that people with type 2 diabetes and heart disease are more at risk and tend to do less well, and we do know that being of Asian origin increases your risk of those conditions, but that hasn't, that's just as another association. We don't really know, and we are going to be working on this virus for generations, I think. Yeah.
Yeah.
So, well, Rachel's having a cup of tea and a piece of cake. I hope you're enjoying it, Rachel. I think that is pretty much it for this week. Oh. Right, bear with me. Oh, sorry, that's what's your opinion on private healthcare and profiteering? Do you see this as a risk, especially in countries like the USA? One thing that I have touched on is that antibody testing, which is being offered privately. Interestingly, the opposite, I think, is true in a lot of cases. A lot of private hospitals and clinics, I think, have offered their expertise to the NHS, which is actually quite heartening to see. Unfortunately, we will always find people who will seek to make money out of other people's hardships. I mean, we've heard some horrendous stories of scammers taking money out of, from often older people's, lifetime savings. So, of course, there's always going to be some bad sides to this. But actually, I've been quite heartened to hear of some private doctors who are looking to support the NHS rather than actually fill their own pockets. Oh, here we go. Does fibromyalgia make a difference to coronavirus, in your opinion? Okay, so we don't know that having fibromyalgia is necessarily going to make you more prone to coronavirus. But if we think about the symptoms of fibromyalgia, that utter fatigue and pain, then actually it's easy to see that coronavirus is really just going to exacerbate things and make you feel so much worse, and your ability to get back on track and feel completely well again is I think going to be delayed. So it's not so much that the condition itself makes you more prone to coronavirus. I just think the combination of the two is likely to sort of knock you sideways and mean that you're going to have to take a little bit longer to recover, I think. And a question saying, is it okay to sit in a community garden if no one else is there? So I assume by a community garden you mean perhaps a shared garden with a number of different houses. We are allowed to sit in our own gardens. And I guess it will depend a little bit on different police forces and the way they interpret the guidelines. And we've all seen pictures in the news of people being moved on from sitting on benches and so on in public areas. We have a bench actually outside my surgery, and it's been taped over because we were aware of the number of people that were sitting and touching that bench. And I think that's the sort of issue, is that if you're touching a bench, if you're sitting in a community garden and then somebody else comes along. So I think if you're sharing a garden with another property, then as long as you're socially distancing, you're probably well within the guidelines to spend some time out in the fresh air in that is your garden. I wouldn't advise sitting on public bench areas and so on, just simply because we know that the virus can survive outside of the human body. Okay. I think that's it. Anything else you wanted to say?
I think the only other thing I'd love to say, Dawn, is about mental health. We talk a lot about physical health, and there has been a drive to make people more aware of mental health, and to try and take the stigma away from mental health. Mental health is every bit as important as physical health, and every bit as dangerous. People die from mental health conditions that they're too ashamed to talk about. And this is the most testing time any of us will ever have known. And again, it is that bit about reaching out, getting support. We've got wonderful charities like the Samaritans who are there all the time, reaching out to people and saying, I'm struggling. It is a real strength. You said it earlier, and you said you're not worried about the mothers who come in with babies saying, I'm really struggling. You're worried about the ones who say, no, it's all fine. And we have this sort of, the positiveness of social media and the internet, but these sort of fake lives we know about, people living on Instagram, Facebook, and all the photos are touched up and it's this perfect world, and then the next minute they're getting divorced and terrible things are happening, and it's all been a complete fake. And we're seeing the same thing with this. And you see people who, everyone deals with it differently, but the people who are learning a language or making bread, good on them if that makes you happy. But then you see other people saying, I got out of bed this morning and I feel good about that. And it's so important to look after your mental health and to have realistic expectations and do whatever it is that gets you out of bed in the morning, as long as it's legal, as long as it really is something that's good for you. Do it. And if the most you do is you get out of bed in the morning and that's it, well, good on you. And reach out. Don't be afraid to say, I'm really, really struggling, because everybody is. Everyone's going to be having massive roller coasters of emotions at the moment.
Absolutely. Do you know, I think that's probably a nice note to end on. And I guess probably perhaps we'll both ask you all to think of somebody that you've perhaps lost touch with this week. Get your old address book out and just touch base with people. A lot of people are not seeing another human being. There's a lot of loneliness out there, and a telephone call, just reaching out to people. Or if it's you that's struggling, then please pick the phone up and tell somebody, because we are living in crazy, crazy times, but there is still an awful lot of help out there. So listen, thank you for your company. We'll be back again next week at 3 o'clock behind the barn door. So don't forget to email me any questions you have during the week. I'll be picking those up throughout the week. My email is drdawn@barntheatre.org.uk. And next week by Skype, I'll be joined by actress, presenter and travel writer Julie Peasgood.
With a vision not just to create challenging professional theatre, but to use this as a platform to In March 2018, we opened our doors to the public with a vision not just to create challenging professional theatre, but to use this as a platform to inspire and bring communities together. Theatre and culture build identity. With theatre and culture in our local life, the community landscape is more vibrant. Local life is enriched. We believe that the benefits of theatre should be available for everyone. Our Theatre for All programme has removed financial barriers, giving disadvantaged people access to the theatre free of charge.
So we were told that we'd come here and have a Christmas meal and then go and watch A Christmas Carol.
Our aim is to make live professional theatre available to everyone and use that experience for positive change. Theatre can be transformational in young lives. Our academy is now in its 4th year, and we continue to build on our vision of bringing the best performing arts tuition to the heart of the Cotswolds. We work hard to make our academy as inclusive and as accessible as possible. Discounts apply for parents with more than one child. Our bursaries help support talented children from less affluent backgrounds. The Academy creates a fun and challenging environment where children can build friendships and develop key skills not just for theatre, but for life. We are also able to provide real opportunities for students who wish to pursue careers in the arts.
My name is Harry Apps. I am currently playing Marius in Les Miserables in the West End.
Barn outreach and learning programs engage with thousands of people. Our free workshops support the drama curriculum in local schools. Singing and musical theatre workshops in community groups and care homes have helped address issues of isolation. Our Song for Cirencester project in aid of mental health charities brought our community together in an unprecedented way. We've collaborated with many charities in the region, including the Churn Project, to support individuals dealing with the barriers to finding work.
Since working with you, my life's changed. It's given me some purpose, given me an interest, some confidence I was lacking prior to all this.
The Barn Theatre played a pivotal role in the town's 2018 World War I centenary celebrations. Who could forget our record-breaking Human Poppy? Our live streaming work on the annual Advent Festival helped thousands engage and take part in Cirencester's Christmas festivities. In these times of uncertainty, we strive to keep the community together. The theatre may be temporarily closed, but our commitment to you goes on. Even now, our amazing costume department are helping the NHS by making scrubs for frontline workers. We've used our technology to build a free live streaming service that provides much needed community news and entertainment for all the family, broadcasting every day to keep us all connected. We are not just a theatre. We are the Barn.